Hello, everybody. Welcome to Just for Women Africa. My name is Ololeko. I'm also the founder of Just for Women Africa. Today, we're on an interview all the way from the United States. We have with us Dr. William Arthur Simmons, who is a psychologist and has been around for 15 years. She specializes in healthcare management, and she'll be talking to us about that, her journey from Liberia to America, and why she wanted to be a psychologist. So stick around, and we'll be right back. Hi, everybody. Welcome back to Just for Women Africa. And we have with us Dr. Simmons. Dr. Simmons, you're welcome to Just for Women Africa.
Welcome. Thank you for having me. It's a pleasure.
You're welcome. Dr. Simmons, you've been practicing for the last 15 years as a psychologist. But before we get into that, could you tell us about your journey from Liberia to America? How did that transition come about?
So I was born in Liberia, West Africa, and I basically was a child during the Civil War in Liberia. And my father came from the United States to come and get me and my sister. So I was 12 years old when I left Liberia to come to America. And that was basically how I left there, just because he wanted to get us out of the country for safety. So I immigrated here to start a new life.
Okay. So just to clarify, so did you witness the war in Liberia during the time, or it was after the war your father came for you?
Oh, yes. Oh, yes. No, I witnessed the war. I was at the time I was there, I was there with my grandmother. She raised me. So both my parents were here in the United States, and I went through the war. I went through, seeing people get killed. I went through dodging bullets and having a bomb, land right behind our house and shattering all the windows and doors. So I went through all of the gruesomeness of the war.
So let's talk a little bit about the war. I mean, I know that was like years ago. Now you're grown and all. Do you still reflect on the war and get flashbacks?
I still reflect on the war, but I no longer suffer from flashbacks about the war. There was a time when it was a lot more prominent, a lot more in my face. But right now it's been 28 years. It's been a long time. So it's not something that I have flashbacks on, but I do see the remnant, the outcome of the war, the impact that it's had on Liberia. And those are the things that I reflect on in terms of, infrastructure, in terms of mentality, in terms of just so much that's no longer the same. So when I think on the war, I think on the impact or the aftermath of the war, not necessarily going through it and reliving it.
All right, you're a psychologist, and could you tell us why did you want to be a psychologist? Does it have anything to do with the fact that of the war, or you are trying to discover yourself and you want to be a psychologist, or you just love to be a psychologist?
Yeah, I hadn't at the time when I decided to be a psychologist, I didn't quite tie it into my experience with the Civil War. But as I reflect back, I think it was a driving force for being a psychologist. Looking naturally, my person is just naturally someone that I'm interested in people and understanding them and understanding why we do what we do. That's always been me since I was a child. But I think I pursued psychology because I saw the negative impact that the war had on people, and how a whole bunch of people went through the war, but some people came out seemingly okay or seemingly unscathed, and others had a really they're still recovering from it even years later. So just looking at the difference between two people that went through the exact same experience but coming out differently, that really interested me. Why do we behave differently even after we've gone through the exact same thing? So just that curiosity in human behavior and human thinking was what led me to the field of psychology.
Well, this is Just for Women in Africa. You have 15 years under your belt as a psychologist, and I'm sure you've seen a lot of women, approach you. What kind of cases do you deal with?
Yeah, so let me a quick point of clarification, and this isn't on you, it's on me. So I've been a psychologist for about 15 years now, but I've been in the field of mental health for over 20 years. So in terms of women and cases that I've seen, I specialize in trauma. So whether it's physical abuse, verbal abuse, sexual abuse, those kinds of things, or even post-traumatic trauma, people that have gone through war experiences, things along that line. And then I also do a lot of mood and anxiety disorders. So depression, anxiety, bipolar disorder. This is, when your mood is, you're down in 1 minute and you're up in the other. And then the other thing that I do a lot of work with, as in terms of seeing women, or women who experience schizophrenia, right? So schizophrenia, it's a mental health diagnosis where people hear voices, or they see things, or they feel things touching them, or they may have certain delusions that they think, okay, because of trauma, because of things that's going on in their life, they might think there's somebody that they're not. Oh, I am Jesus, but we know that they're not Jesus. Those kinds of things, right?
Yeah.
But those are, I like the difficult cases. So that's what I'm drawn to. And I do a lot of marital work as well. So I see women in the context of relationships too.
So, I mean, you just mentioned, somebody comes and saying they're Jesus, but they're not Jesus. So, what's your approach to, therapy for such a person?
Yeah, so there's a lot of evidence-based practice. I know, in where we come from, I can't speak for all of Africa, but I know in Liberia, usually when somebody is going through something like that, we just say, "Oh, somebody wish then that juju, that wall, everything," and so any and everything, we'll just like, "Oh, maybe somebody from the village don't like them," those kinds of things. But here, but here we know we have a lot of research that looks at the mind, that looks at the brain, how it's different from other things. There, I can go on and on about evidence-based practice for schizophrenia, but the approach that I personally use is something called recovery-oriented cognitive behavioral therapy. And it is all about, first of all, understanding the full person, their system, what makes them do what they do. When they're talking about their delusions, is not about the content of what they're saying, but it's the meaning behind what they're saying, and that's what we get at. The other things that help a lot of times is family supports. And then we use an interdisciplinary team, meaning you need a psychiatrist, a psychologist like myself, a nurse, different people working together from a frame that knows that this isn't somebody just that somebody wished them, but rather this is an actual mental health. This is an actual brain disorder that can be tweaked. So it's a lot of different things that we use, but medication, psychotropic medications, CTR, recovery oriented cognitive therapy, and then family based therapy is really great with that kind of person as well.
I'd like to touch on something you just said. You said it's not really about what they're saying, it's about the meaning into what they are saying. Could you give us an example?
Let's just say somebody may have grandiose delusions, meaning somebody says, "I am Jesus and I'm here to save you all." A lot of times when you really sit and talk with that person, what we realize is that their delusion serves as an overcompensation for what they're truly feeling, meaning underneath all that might be someone that feels broken, that feels defective, that feels not good enough. And the way that they try to compensate for that is their brain says, well, if I make myself bigger, then people will treat me as such, and then I will feel better. So from the layman's eye, it just looks like, oh, you're just talking gibberish, but it's been proven over and over again. And I worked for a decade, over 10 years at a mental health facility, uh, specifically just for patients with schizophrenia, just for that kind of behavior. And I was the team lead, the lead psychologist on that. And we did a pilot program. And every single time we got to the heart of the matter, not just what they're saying, but what do they mean? What are they really feeling? What are they trying to compensate for? When we could get at the heart of the issue, we saw a lot of improvement in the person. Because if you're acting grandiose, you're saying, "I am Jesus, I am the Blessed Virgin Mary, I am Muhammad," whatever you say that you are. And we realize over and over again, when you see a theme, you say, okay, they must feel not good enough. They must feel this. We treat them special. You're treated as though you are important, and you don't have to pretend to be Jesus, or you don't have to be Jesus. I'm using Jesus as an example. Sorry, people. You don't have to be someone huge in order to be valued. And so we add value to their lives, and more the whole idea of those delusions, you see them get quieter and quieter and less. Why? Because you're really addressing the heart of the matter, not just the words that they're saying.
Now, let's talk about medication. And when it comes to therapy, do you believe in medication? Does it really work? Or, do you just feel that, people should change their diet, exercise more, and do, things that not they usually wouldn't do?
When it comes to our overall mental health, I'll just say it's a combination of everything. You have to do what works for you. For some people, depending on what the severity of their illness or their condition or problem, whatever they're going through, diet and exercise and family support might just be all that they need. For other people, they need the diet, the exercise, the therapy, along with the medication. I have seen medication do wonders in a lot of people's lives over the last 20 years. I've also seen a lot of people do quite fine without medication. So that's something that's treated on a case to case basis, depending on what the person's specific needs are.
Okay, well said. Okay, let's move away from psychology and let's talk about something else which you do, which is healthcare management. Could you tell us what exactly is healthcare management?
Sure. So healthcare management focuses on helping healthcare systems effectively run their operation, right? So how does a hospital run effectively? How does what kinds of strategies and vision needs to be in place for your hospital to survive the first 5 years of operation, and then the next five, and then the next five. It's about being the connecting the dots between different departments and different directors, and so that everything can make sense. You are the person that put the pieces together to help a hospital, which may seem like little puzzle pieces to paint a full picture of what it is. So ultimately, the quickest way to answer that question, it's about it's about being able to helping people effectively run their organizations, hospitals, clinics, facilities.
Okay. Does every hospital need a consultant who comes in as a healthcare management expertise like you?
I think it's a great idea because hospitals that are well run have consultants come in. You don't have to be a permanent stay person. Typically, you come in for 3 months, you come in for 6 months, and sometimes it may be a year. But really, to help the organization, either when they're getting started or when they hit a hiccup. When things, man, we were doing so good, now we don't know what's happening. To have that person come in as a fixer, that's what the consultant's job is.
Okay, well said. Okay, so let's talk about something else. You run a podcast called the Bare Naked Podcast. Could you talk to us about that? What exactly do you do?
Sure, the Bare Naked podcast. I thank you for mentioning that. Was recently launched. It's about creating. On this podcast, we talk about taboo topics, the things that people are too shy, too afraid, too embarrassed to talk about. And we create a space for people to talk about it without judgment. And then at the end of each episode, we try to give tips on how people can overcome those challenges. So, for example, the last one we just did was something called imposter syndrome, right? Imposter syndrome is this feeling like it usually affects high functioning, very productive individuals who are climbing up and up and up the ladder where they're going. But every step of the way, some people have a hard time thinking, oh man, maybe I don't belong here. I must be a fraud. I'm not good enough to be in this space. I use my example, right? Being a young woman from Liberia and always finding herself in a space where it's a lot of like big men, that are at the highest place in the organization, and they're the directors and the medical this and that. And then there's me, and feeling like, man, how did I get here? Do I even belong in this space? Are my words valuable? Do I have anything to add? And even when people say to me, oh, I love that you said that. Can you take the lead on this? This is wonderful. This is your expertise. There's still this sense of, I'm not sure that, I'm the one for this particular task. And it affects a lot of people. But anyway, long story short, that's what it's about. We're going to be discussing things like infertility, another thing that people don't want to talk about, they have a hard time talking about, male and female African brothers and sisters, male and female infertility. We're going to be, talking about trust issues. They're looking at them like there's no way that you can be trustworthy. So all the hard topics we will be talking about, but in a healthy way. And I really hope that people can join us. Follow us on all social media platforms at the Bare Naked Pod, and you'll really love it. I did it for honestly, I did it for our people. I did it for Africans. It's for everybody, but I did it because I realized that culturally among Liberians, I can start with Liberians, we don't talk about those kinds of things. But when I'm with my white friends, they talk about that stuff all the time with ease. But when I'm with my Liberian friends, oh, no, don't tell anybody. I know that didn't happen to me. Then when you talk to them, it's like, yeah, it happened. Molestation, incest, trauma. We don't talk about it, and we're dying slowly on the inside because we don't have any space to talk freely about that. So
Okay, let's talk about something which you just brought up, infertility issues. Why is it not, okay, from a psychologist's point of view, why is it not discussed? I mean, why do women and men not talk about it?
yeah, I think a lot of times women don't talk about it because there's a huge taboo around it, right? There taboo meaning like there's a negative stigma on infertility in people's lives. They think, oh, okay, you just go, you do I call it the grown up, but since we're on a grown up show, you have you have sex and then boom, you're pregnant. And for some people that's easy, but for others they spend years and years and years trying. And I think people don't talk about it because they don't want people to judge them. They don't want people to look at them badly. But also there's a lot of guilt from a psychological perspective. You think, well, what's wrong with, there's a lot of shame rather. What's wrong with me? Especially for a woman, why can't I, conceive? Or why when I conceive, I can't keep it? People have multiple miscarriages. That's something that I didn't know was so common. And as I talk to women, I realized, what? You had 2, 3, 4? And I talked to 10 women one time when I was talking about this issue of miscarriage. And do you know 8 out of the 10 women had experienced at least one miscarriage? And these are
Wow.
women I've known for 15 years. None of them said anything. And I would not have known if I didn't specifically ask that question. 8 out of 10 of them.
That's wow. That's huge. Okay, so as a psychologist, if a woman approached you with that kind of issue, what would you be telling them?
I would be telling them, number one, like that it's not their fault. That's the first thing I would tell them, because everyone's like, it's your fault. Oh, maybe your womb is not blessed. Go to the pastor, let him lay his hands on you some more. And I'm a devout Christian. I'm unashamed of saying it. I love God and all of those wonderful things. But I think that it's easy for us to like blame something outside of ourselves. The body is a complicated structure. Okay. So to answer your question, what I'll number one, I'll try to release them of the shame and the guilt of feeling like is their fault some kind of way. I would encourage them to see a specialist, because there are lots of people who have there are so many reasons why people have hard time conceiving. Among Black people, we have like over 80% of Black women have fibroids. Fibroids are in the womb, is blocking your tubes, and you don't even know. You're just trying, nothing's happening. The sperm is not miraculous sperm that's going to go through the fibroids to your tube, to your tubes, So it might turn out you have fibroids. You go there, you get the fibroids removed, boom. You might have some cysts. You may have PCOS, polycystic ovarian syndrome, different cysts in different areas that influences that. Go there, get it checked out, get it taken care of. There's so much we can do. And for the sake of time, I don't want to keep going, but I'm so passionate about that topic. But I would tell them that number one, is not their fault. They can release themselves of that guilt. Number two, see a specialist and see, because it might be more. Number three, I want to point this out because there are men that actually, when we look at the split, when it comes to infertility, everyone always blames the woman, but you'll be surprised. Most times it's about a 60 to 40, 50 to 50-ish split between men and women being when it comes to infertility. Why a couple isn't conceiving is not always the woman. Sometimes the man doesn't have enough sperm. Sometimes his sperm is not mobile, it's not moving in terms of sperm motility. Sometimes it's because it's not moving, it would die right there in the womb, so there's so much there. And the man, in our culture, we say, yeah, you're a man, you can have plenty, just go, just do it, and you see all your boys having kids, but there's so much there, and they may not even know. I work with couples that come in for that purpose in my practice, and it's always devastating when the man finds out, oh, wow, I thought it was my wife this whole time, but it was, it was me. I don't have enough sperm, or I don't have enough, mobile sperm. And, men are very egotistical, and it's like, it does something to your sense of like manliness, but it's okay. There's so many reasons for that, but there's help. There are things you can do always. And honestly, when it's all said and done, even if all those things don't work, I still believe in miracles because I've seen it happen over and over and over again. So I leave room for medicine and I leave room for God. So.
All right, that's a nice one, Dr. Simmons. Okay, Dr. Simmons, we're running out of time, and as we're about to, sorry, Dr. Simmons, we're running out of time, and as we're about to round up the show, what's your advice to women all over Africa who are watching, who look up to you, and would like to be a psychologist like you, but who also feel it's a man's world and who feel the daily struggles of being a woman?
Women, my advice would be women. We are so much more powerful than we think. Brilliant minds. My private practice year is 98% women. And these women are lawyers, they're doctors, they're surgeons, they're entrepreneurs, they're doing wonderful things. And what I would say is, whatever vision is on your heart, whatever goal and dream you have, just put your heart to it. It doesn't matter what the obstacles are, whether it's a male-dominated field, whatever. If that is your passion, you connect with the right people. It's not always about money, but connect with the people that can guide you in the right direction. And there's nothing that you put your mind to that you cannot achieve if you do it wholeheartedly. But I love, listen, African women are gold, okay? Better than gold. We are diamond in the rough, and we can do any and everything. So I would just say, go for it. Sky's the limit. Sky's just the beginning. You are more than equipped for whatever task you want to set your mind to.
I like that. You're more than equipped for whatever task you want to put your mind to. Thank you so much, Dr. Simmons, for being here on the show. Really appreciate it. We love interviewing you. We look forward to interviewing again in the future.
Thank you.
You're welcome. And to our viewers who are watching, do not forget to like, subscribe, tell a friend who knows a friend about Just Women Africa. And from Dr. Simmons and I in America to be. Bye.
Goodbye.